Welcome everybody. Dr. John here with Orlando Alternative Health Licensed Acupuncture Physician. Today I would like to talk about a topic that I often see clinically, and what that basically is imaging or other modern diagnostic tools that do an amazing job and have really helped advance medicine in the 20th and 21st century. Imaging such as X-rays, MRIs, CT scans can all provide amazingly valuable information, as can various lab exams. However, the reason I'm talking about this today is I was at the gym this morning and I heard two guys talking, and this is something that I find very often clinically with patients that maybe the patient has seen their orthopedic doctor and they're waiting for insurance to authorize the MRI and then schedule it and go through, which very often can take several weeks. And in that period, the patient many times, from my experience, believes that when they get the MRI and when they get the results, it is 100% going to contain all of the valuable information that they have to get answers for their case. And as I said previously, imaging such as MRIs do provide an amazing amount of information. However, it is not necessarily the ultimate diagnostic tool that will be all-encompassing, meaning it will not necessarily tell you 100% of the picture of everything you need to know. Perfect example that I see very often with patients with back or shoulder pain, which I treat very frequently. Many times they will have an MRI that shows a herniation in their back, and the MRI report will state, okay, they've got a herniation here, herniation L3, L4, which is a very common area to have one. And with that information, then their orthopedic doctor will tell them that, okay, you've got this herniation, this is the cause of your back pain, and we're going to do maybe epidurals or some other procedure to simply address this herniation. However, research shows through various studies that there's a much likely people are much likely in general to have herniations as they age. And with that, you could take, say, a patient of 40 years old that has a herniation at L4 and another patient with a very similar age and similar MRI. One will have excruciating pain, one will have no pain. So that tells us that the MRI is not all-encompassing when it comes to pain. This patient that I was listening to this morning, or not patient, but gentleman at the gym, sounds like maybe he has something neurological going on, that they are ordering an MRI to try to find the root of it. And I hope that gets him the answers. It very well may. But I may be a little bit skewed because very often in my practice, I will see the cases that people will have an MRI, people will have various blood work tests, people will have various other standard Western diagnostics, and there will be no answer. The doctor will say, well, we didn't find anything. So does that mean the patient's pain is not real? Does that mean the digestive issues they're having are not real? Or is something else going on there? So that brings me to my next point, which hopefully you're still following along here with everything that I'm saying, that the tests and imaging are wonderful, but one of the beautiful things that we have in traditional Chinese medicine is we have our own set of diagnostics. And what we do is we very often look at the tongue as it is essentially a gateway into the body. So what do I mean by that? The tongue will have a coating, a shape, a size, a color, sometimes various marks on it. And all of those can reflect what is going on deeper inside. So that is one of my favorite tools to look at for various conditions. Additionally, there are other types of diagnosis available to us that sometimes we will feel various positions of the pulse near the wrist on either hand. Sometimes we may look at the eyes, and then there's just a whole slew of other things that we'll look at depending upon what the patient's complaint or main problem is. So that might be their gait, the way you walk, their posture, the way they carry themselves, various orthopedic testing. I use a system of testing called the XTOR testing, which is a very efficient way to observe abnormalities in the body and get to the root cause of pain. And a lot of what what we will see in clinic through the XTOR exam, it will not necessarily show up on an MRI. So my point here, to summarize, is, again, we have amazing diagnostic tools available to us, and sometimes they provide us with all the information we need and some information we may not be aware of. However, very often they are not all-encompassing, and there may be more to the picture that we need to investigate to really get the answers and get to the root and get to the ultimate solution in the right way. So thank you for tuning in today. I hope you have enjoyed this. If you like this, please subscribe to my YouTube channel, which is Orlando Alternative Health. I also have a website, which is orlandoalternativehealth.com, Instagram, Orlando Alternative Health, Twitter is Orlando_alt, I believe. And let me know what you think. Feel free to leave some comments here. Hopefully you like it, and I wish you well. Thank you very much.